had her gallbladder removed laparoscopically, and then during her second pregnancy has now developed a protruding belly button. Well, this can happen. It is probably likely due to the surgery she had for her gallbladder. During that procedure, they call it laparoscopic cholecystectomy. They create a small incision at the belly button, and there's a small opening made right through the abdominal wall into the cavity, abdominal wall cavity. And that's where they usually place a camera, they have to place certain instruments, and they also make other pokes in the abdominal wall. But through that one at the belly button, there's an opening made through the muscle wall where a camera is placed to do the procedure for laparoscopic cholecystectomy. Now, at the end of that procedure, the little opening is usually closed up with some very strong sutures in that abdominal wall. It's possible what happened during her second pregnancy. The wall is stretching, tissues are getting a little more loose, and as that stretching is occurring, it's possible the stitch that was put in could have broken, or maybe wasn't very strong, or the area that was repaired was still very weak and it stretched. And when that stretch happens during the pregnancy, that little opening could recur where that surgery was done for the cholecystectomy. And now there's a little hernia that's developed where there's fat from inside the abdomen kind of pushing through that little opening in the abdominal wall. It's under the skin, but it's pushing the skin up in the belly button, so it's giving you that outy belly button. So it's possible in her case that she's developed a small umbilical hernia during her second pregnancy, but it's secondary because she's had a previous laparoscopic cholecystectomy surgery. Fixing this outy belly button or the umbilical hernia, once her pregnancy is finished and completed, and after, say, several months go by, 6 months go by, and she's not breastfeeding or anything anymore, if there's still an issue with an umbilical hernia, this can be fixed. A lot of times I do these right here in the office, local anesthesia, where we numb it up a little bit. We make a small incision, probably through her old scar when she had from her previous surgery. Get in there, find that little hernia defect, push the fat back, close up that abdominal wall again. If there's a little opening there with some really strong sutures, close that up, the hernia is fixed, and we can get her back to having a normal looking innie belly button.